So the three common myths about LASIK are: it is painful, risky, and not permanent. LASIK is certainly not painful. With the advent of bladeless LASIK, even the pressure which is given on the eye is so gentle that patient will feel something is going on, but there will be no pain. After LASIK, within first 6 hours, there are some patients who will get some amount of pain, but that number is less than 1%. Most of the patients are pretty comfortable. Then comes risky. LASIK is not risky if the tests before LASIK are done properly. We have to assess dryness, we have to assess cornea, that means the front part of the eye, which is a transparent glass, whether the thickness is enough, how much is the dryness. We have to weigh the muscles, whether there will be imbalance after the number is removed. Then there is a new test called corticosity, which tells us the strength of the cornea and whether the LASIK will be suitable for that eye or not. So if we do all these tests, retina test is done, and if any problem is there, it can be treated. And when you go through all these things, the chances of complications are very low, and therefore it is not at all a risky procedure. And lastly, the permanent. If LASIK is done after the growth of the eyes or body is complete, it is certainly permanent. So normally we do LASIK after the age of 18 when the number is constant for 1 year. But this is a general rule. Ideally, I would like to wait for 2 years in some cases, or beyond the age of 20 in some cases. This depends on patient to patient. And therefore, if this rule is followed properly, it is permanent. Patient is not going to get number back. Now, there are some patients, very rare, that during pregnancy a lady can get number. But in most of such patients, it can go back also. So, LASIK is safe, permanent. It is the most commonly performed, or at least one of the most commonly performed surgeries in the world today, because it is safe and permanent.